Okay, good afternoon. This is Bruce Robinson from Arbor Research and the Dialysis Outcomes and Practice Pattern Study, or DOPPS. Thank you all in the community, dialysis community, for joining us today, and Happy New Year to you as well. This is our January 2017 webinar update with respect to key updates in dialysis practice from the DOPPS Practice Monitor, as well as, in particular, focus on topics of interest to the community. Okay. All right. And so I have just a few introductory slides, and then we'll pass on to the content of the hour. Mark Newman from Nephrology News and Issues will be speaking and reviewing some key developments related to dialysis policy. It's really been a lot going on of late, and quite a bit of press related to dialysis patients and the joining of ACA-related plans, as well as insurance premium assistance issues that have come up regarding that. Many, or perhaps most or all of you, have read of this in the press. So Mark will give some comments on that and other updates related to dialysis policy and payment issues. Following that, Doug Fuller, a senior analyst at Arbor Research, will give an update on key trends in the DOPPS Practice Monitor. And lastly, Dr. Francesca Tintori will provide an overview of a recent publication of ours focused on dialysate potassium, which remains an area of real interest to the community. So Dr. Tintori will provide updates from that paper and some thoughts with respect to sort of optimizing dialysate potassium and approaches to management of serum potassium. Okay, just before moving on, I would just like to note that the DOPPS program would not be possible without the support for our independent scientific research from organizations listed on the screen, including our core or principal funders, Amgen, Baxter Healthcare, Kyowa Kirin, as well as additional project or country-specific support as noted, and public funding support from a variety of government entities in the U.S. and worldwide. Okay, so data from the DOPPS Practice Monitor are derived from our publicly available website, available at www.dopps.org/DPM, and we do have data updated every 4 months, most recently at the end of December, with greater than 1,500 figures and tables, including downloadable data tables that are underlying the tables that we show. We have had, for the last couple of years, over 200, a national sample of over 200 dialysis facilities, including facilities from the 2 largest dialysis organizations, DaVita, Fresenius, also a substantial complement of data from VisionX, which is an electronic health record provider used commonly by the non-LDO dialysis unit. Okay, and please feel free to join us on Twitter, as noted here. You can follow us at DOPPS Study or use the hashtag DOPPS for tweets about today's webinar. Please feel free to join the conversation. Okay, we also have CNE, Continuous Nursing Education Credits, available, as noted on this slide. By the way, slides for this presentation will be available from our website immediately after this session. So if you need additional details, please feel free to check out our website. And learning objectives, as noted on this slide, these actually relate to the 3 different key content areas that we'll launch into in just a moment, and as already reviewed. Okay, and lastly, we are, as always, interested in an interactive hour, so happy to receive questions from you as well as feedback. So please submit your questions using the Chat with Presenter feature accessed by the blue icon located at the bottom left corner of your screen. And we'll pause after each speaker is finished to discuss questions. And we'll also give poll questions for the audience to respond to and that we can comment on in real time as well.